Hey, Dr. David.
Hey, how's it going?
I'm doing good. How are you?
Doing wonderful.
You ready to do this interview today?
That sounds great. Let's do it.
Awesome.
Hi, my name is Dr. David Cook. I'm one of the co-owners of Aviator Home Health. I'm also one of the lead physical therapists with Aviator Home Health. Well, I became a physical therapist. I guess I started thinking about becoming a physical therapist when I was playing sports in high school and in college. You know, I had multiple sports injuries, which led to many physical therapy treatments and dealing with multiple physical therapists. So once I got finished with college, I went into physical therapy school. Grueling 3 years, but it was worth it. I loved every minute of it, and it allowed me then to go on and help others that had injuries like myself. I dealt in the beginning with a lot of patients that had injuries, sports injuries specifically, and then transitioned into a lot of patients that had total joint replacements, total knee, total hip replacements. And I would see many times that the patients that had those surgeries, total knee, total hip, total shoulder replacements, that after they had those surgeries, they would tell me that they had home health care. And they would then have home health care from anywhere from 4 to 8 weeks, sometimes even more, and then they would come to outpatient and see me. And many times they were way behind in their progress. A lot of times the doctors would be a little upset with what was going on in home health. They try to get them out to the outpatient clinic to see us and get them going and really ramp up their progress. So eventually myself and then my other co-owner, partner with Aviator Home Health, Dusty, we decided, hey, let's try to make a difference and bridge that gap between outpatient and home health. So we started to brainstorm and talk with other therapists in the community and get their feel for what was the reason why home health was lacking on the physical therapy side. And so we collaborated. We had the opportunity to come in together with Tunde, and another clinician, a nurse, and really get Aviator up and going and start really bridging that gap and treating patients and giving them the correct type of care that they really deserve. So some of the health problems that we can deal with here at Aviator Home Health can be anything from neurological issues, cardiovascular issues, musculoskeletal issues. Some of those things entail a patient that might have had a stroke, may be diagnosed with Parkinson's disease, any type of joint replacement, like a hip, knee, or shoulder replacement. And then also down to the things like gait issues, just typical balance issues. As we age, our balance decreases, and that can lead to falls, which then can lead to other serious health problems. So that being said, we can help with those things, but we can even help with many, many more. I'm so passionate about what I do with Aviator Home Health because I truly care about the patient and their families. Myself and the other co-owners of Aviator Home Health, we truly see a lack in the home health industry here in this city and nationwide, and we really want to be on the forefront of changing the home health industry and really making a difference in the patients' and families' lives. You know, here at Aviator Home Health, even our team, every member of our team, communication is excellent, teamwork is excellent, and the caring factor, just communicating with the families and patients, they all truly care. Myself and some of the other teammates here at Aviator Home Health, we joke around with one of the other co-owners, Tunde Holdren. She was the one who started Aviator ground up, and she is so giving. We joke around with her because a lot of times she's too giving, and she would do anything to really to help the patient, help the families get through their difficult time. So one of the most memorable success stories, it's hard to really pick one because when you've worked in the industry and you've really treated a lot of patients, you become like a family member to each and every single one of them, and it's just really awesome to see each one thrive and get better, and even help their families with some of the stress they're dealing with, and teaching some of the families on how to deal and cope with some of the situations. But most recently, what stands out in my mind is that we recently had a Parkinson's disease patient. The patient was sent over to us right after also having a total open heart surgery. So they had open heart surgery, diagnosed with Parkinson's disease, multiple other comorbidities. I was the lead physical therapist, evaluating and treating therapist. I went in there day one. The patient was really having difficulty doing everything during their everyday life process. Anything from just trying to stand up from a chair, trying to go and eat breakfast, lunch, dinner, just even trying to get in and out of a car to make it back and forth to doctor appointments. I really truly thought after that very first day, meeting with that patient and the family, that we would be seeing the patient for anywhere from 120 to 180 days to really try and get the patient where they needed to be, to where they could get to outpatient therapy. Lo and behold, though, 4 to 5 weeks later, the patient had a follow-up with the doctor, and the patient was doing excellent. I couldn't believe it. We had started the LSVT big program that's just specific for Parkinson's disease patients, as well as doing a cardiovascular program and doing a lot of hands-on training with the patient, and the patient just thrived. Patient got better within 4 to 5 weeks. They were approved and ready to go to outpatient therapy. We were no longer having to assist the patient get up and down from a chair, or even getting to and from the bathroom or to the dining room table to have meals. The patient really became independent again. It took a lot of stress off the family member because they weren't having to help out as much anymore, and they could really just start to enjoy their lives once again. And that was one of the most memorable experiences in the most recent past. There are 4 main reasons why you should choose Aviator Home Health. First reason, we understand what you're going through. We understand that if you're a patient, that you've had an illness or an injury or some sort of setback that's decreased your level of independence, and you're wanting to try and get back to that independence and get back to your regular life. Also on the family side, we understand that if you're a family member of the patient that has had the illness, that there's a level of stress and heartache, and so a lot of times questions. You're just confused on what to do, how to do things, what's appropriate. And Aviator and our team, we're here to help. We understand. We have a lot of years of experience throughout our clinicians that are out there, that they know with specific diagnoses and illnesses and injuries, they know exactly what the family has in their minds on questions, and we're here to help. We're ready to walk you through that process and get that patient back to that level of independence that they deserve. The second reason you should choose Aviator Home Health is we'll treat you like your family, truly. I was just talking with one of the other co-owners, Dusty Anderson. He's our director of rehab. I've actually talked to him on multiple occasions about this as we've been out there treating patients, and he'll be the first one to tell you that he truly feels like he has 1,000 grandma and grandpas out there. He's told me on several occasions that he'll walk right into the family member's home after a couple visits. He's become like family, and he'll address them as grandma or grandpa, and they have a good time, and they have a good time getting the independence back together, and seeing the pain decrease, and getting back to being healthy again. The third reason why you should choose Aviator Home Health is that we truly listen. One of the things that we've noticed, and you probably noticed as well, is that a lot of times healthcare professionals just don't take the time to truly listen to what's going on, whether you're the patient or the family member. One of the things that we pride ourselves on at Aviator Home Health is that we truly listen. It's two-way communication. We want to communicate with you and educate you on things that we really feel that are vital for you to know, but we also want to hear what you have to say, what you're experiencing, so we can really tailor those answers and that experience to you. So the fourth reason you should choose Aviator Home Health is that we get results. We get great results. We get great results, and those are attested to by our patients on a weekly and a lot of times daily basis, either from phone calls, patient testimonials, and even handwritten cards. I actually got one about a week ago that really touched home with me. It's been sitting on my desk. I want to go ahead and read it for you now. We want each of you to know how very much we thank you for your expert care, your calming spirit, your guidance, and your sincere concern. We know God blessed us through you. We will be forever grateful, and we think of you as family. We actually miss your visits. That is why Aviator Home Health exists. That is why we do what we do, and again, we get great results. So how do you contact us here at Aviator Home Health? Well, there's several ways. Whether you're a patient, a family member, a doctor, a social worker that is needing to refer us a patient, here is our information. It's right here. You can call 972-548-2163. Go straight to our intake department. The ladies here at the front office do a wonderful job in getting you the information you need. Also, at www.aviatorhomehealth.com, you can go there as well, and there's a form there that you can fill out online that will get to us. Hope you have a good day.